One thing I will always do in my medical practice is to keep my pathology practice completely transparent, unlike any other pathology practice that I know of anywhere in the world, not let alone in Georgia or America. And so what I want to show you from that last case I posted where there was a botched hernia surgery prior to the patient going in for a recent surgical exploration. I want to show you the slides that I submit. On all of my cases, I usually submit lung sections, I submit heart sections, even including coronary arteries. And then I submit pancreas and liver, spleen and liver sections, along with kidney sections, adrenal glands, and I'm gonna go to the next slide to show you additional sections. Okay, this is the start of intestinal sections. You can see I submit stomach sections of stomach and small bowel, large bowel. But I'm going to stop this video to show you the next tray of slides. Before I go through the next tray of slides, you can see that these lung sections are relatively normal. Even if you look at it, you see the spongy nature, you see the aeration and so forth and so on. And I'm not going to show you slides of normal tissue. Here's the heart section. It was very normal as well. And here's the pancreas. You can see the outline of normal pancreas, normal spleen, normal liver. And then obviously, I think actually this was the liver here. No, that's not. There is the liver. Sorry about that. That's the liver. The pancreas, the spleen, and then the kidney sections here. But they were all fairly normal, except the kidney did have changes of hypertensive changes, but the adrenal glands were okay. And most of the intestine, believe it or not, was quite normal, except that which was encased in some of the scarring fibrotic hernia tissue. But I'm going to go to the next slide. So here's the next tray of slide, which actually gets into the inflamed tissue. You can see a little hemorrhage there, but a lot of these are random sections of that tissue that I showed grossly. Most of all of this is. And then obviously I took sections of brain. You can see a little cerebellum outline there, and there's some other brain tissue, and also bone marrow. So, and I'll show you, I'm not going to show you the sections of marrow because most of this, the brain and the marrow was essentially okay. But I want to show you, I'm going to show you random sections of this inflamed scar reactive tissue that showed also foreign body giant cells and engulfed suture. So I'm going to try to select some of the sections that to bring out the details of what I'm trying to bring out. So I'll begin at this low power, as again, pathology is extremely objective, sir, or people. It's not based on opinion, it's based on facts of science. And so I'm going to start by showing you this extensive hemorrhage involving a reactive and inflamed scarring fibrotic connective tissue, which was a part of that mesh of tissue that I showed. And I'm just going to scan around first just to show you the gestalt of the overall. This is all scar tissue. And without getting into too specifics about this, because it's not going to show much but inflamed and reactive scar tissue. And you can see that I just wanted to kind of highlight on closer power some features. As I explained, this is all inflammatory tissue here. And there are some areas of abscess and necrosis that I'm going to show you as we get to those areas. And the video will go in and out of focus as this is a live video. But for the most part, you'll be able to see what I'm seeing. Okay, here's an area of necrosis there. And you can see some abscess in that material there. You see even foreign polarizable material with that abscess. That's probably degenerated suture. But I'm going to convince you that is indeed sutured on some of the other slides. But I like to keep it very publicly transparent. You get these big eyes, little U's talking about he doesn't know what he's talking about. This doesn't show that. In particular, this was a prominent hospital. Look at it. We're getting in fat necrosis. You see some foamy cells in there. And you see that with fat necrosis. You see some calcified debris there. Okay. But I like to keep it transparent because, again, I've been doing this now for 30 years. And in spite of that, you got people who don't want to look at science just because of the nature of who I am. But I like to show it completely transparent. And let me go to the next slide without wasting a lot of time just to kind of show you how I came up. But this was not tumor, but rather reactive tissue. And I'm going to show you extensive bone metaplasia, which that is a feature of part of reactivity on long-standing unresolved inflammatory processes. So here's an example of exuberant bone metaplasia. It's almost like it's a bone organ, but this was actually in that tissue, that mesh of tissue. Here's some necrosis here, more fat necrosis, but it was in that mesh of tissue from the abdomen, which I showed grossly. And this is mature bone metaplasia here. As I go in, again, it's going to go in and out of focus, and but we're going to try to control that as best we can. Again, this is a live video, so you're going to see some in and out of focus. But let me just quickly go around so I can show you some of the suture material that was seen in this. There are some areas of necrosis and fat necrosis and abscesses. And as I continue to show you the overall histology, okay, it may not be in this area, but I'm trying to see. There was some foreign body giant cells, but I wanted to show you the bone metaplasia in that particular slide. And I'm just going to go down to a higher power so you can see the bone tissue up front. I mean up close rather. As you can see, that is mature bone. That is not neoplastic bone. Very mature bone with extreme organization, as to suggest that this bone development has been there for some months on end, even perhaps years. This is not something that just popped up acutely or in a short distance of time. And it's mixed with fibrous tissue, fibrofatty tissue, with obviously fat necrosis, as you see the little foamy cells there. But let me keep going with the video, with the next slide. So without prolonging the inevitable, here is an example of one Sutra Granuloma. And you can see the multinucleated giant cells, and you can see the polarizable material. Of course, I'm not going to try to polarize it, but let me see if I can go down one more. Oh, I can. Perfect. Just to convince you that those giant cells have suture material. That's to suggest that even before I knew the clinical history, I knew that there was previous surgery because of what was left behind, and that is suture. You see that? Clear example of suture within giant cells, multinucleated giant cells. You see I'm going to go up and down and to go in focus. You see that hazy looking material right adjacent, or actually inside the giant cell there as I go up and down. That's suture debris. Okay, more of it. So I think that proves the point. Even before I knew she had surgery before, and it was confirmed by a family member that indeed she did have hernia surgery prior, long years before.